Botox is more than a treatment for celebrities. In fact, in 2014, there were 3.5 million Botox injections for cosmetic use alone. But what exactly is Botox, and how does it work? The active ingredient of Botox is type A botulinum toxin subtype A1, a protein derived from the anaerobic bacterium Clostridium botulinum. The desired cosmetic effects arise from the proteolytic cleavage of a 9-amino acid portion of the C-terminus of the 25 kilodalton neuronal binding protein SNAP25. This eliminates the ability of the neurotransmitter vesicle to exocytose. We will show that the structure of type A botulinum toxin leads to a high catalytic efficiency with its substrate, SNAP25. There are 7 different types of botulinum toxin. However, only 2 types are used in medicine, types A and B. Type A is more widely used because of its higher affinity for SNAP25. The amino acid composition of botulinum toxin type A was originally determined by Shantz et al., who also determined its structure via crystallization studies. The toxin is synthesized as an inactive single chain of 1,296 amino acids. The chain is cleaved to produce a 100 kilodalton heavy chain and a 50 kilodalton light chain, which are held together via a single disulfide bond and non-covalent interactions. The active toxin has 3 domains: catalytic, binding, and translocation, with the catalytic activity mediated by a zinc ion in the light chain. The binding domain is located in the C-terminus of the heavy chain and consists of 2 subdomains. Each subdomain is composed of beta strands connected via an alpha. This domain binds a ganglioside on the neuron membrane surface and initiates endocytosis of the toxin. The translocation domain is located in the N-terminal region of the heavy chain. It lies across the catalytic site and covers the active site of the light chain, altering the charges. This alteration mediates the translocation event of SNAP25 into a catalytically active state, ready for the catalytic domain. The catalytic domain is located in the N-terminus of the light chain. It consists of the zinc 2+ metalloprotease, which mediates the cleavage of SNAP25. This cleavage prohibits the release of neurotransmitter vesicles and stops communication with the adjacent muscle. The disulfide bond, which links the heavy and light chains, is reduced upon exposure to an acidic environment such as the cytosol. The light chain enzyme can then refold into its active conformation. Wang et al. Found that the toxin has a high endopeptidase activity, as well as distinctive cleavage efficiency when binding the SNAP25 substrate. In this study, the activity of subtype A1 was compared to that of A5, a different subtype of the toxin. SNAP25 binding was compared with an optimized control peptide substrate for an in vitro toxin activity assay. Wang et al. Determined a rate of 0.13 plus or minus 0.01 micromolar per minute for SNAP25 binding versus 0.06 plus or minus 0.01 micromolar per minute rate for the control peptide. This shows that the botulinum toxin type A1 has a high binding affinity for SNAP25 relative to other potential substrates, which is due to the aforementioned structural compatibility. Table 3 shows that if SNAP25 is truncated, leaving positions 171 through 206 intact, then the rate catalytic activity is 0.008 micromolar per minute. Conversely, if truncated, leaving positions 152 to 206, then there is an increase to 0.024 micromolar per minute. This shows interactions between peptide and subtype A toxin beyond the cleavage site, implying that other domains are critical for the high binding affinity. The biochemistry of this toxin is utilized for cosmetic use in the form of Botox. By eliminating communication between the nerve and the muscle, wrinkles caused by muscle contraction are reduced or eliminated. Future directions for type A botulinum toxin use include treatment for increased sweating, also known as hyperhidrosis. This is due to the paralytic effect of the toxin, which can be used to inhibit sweat glands. There are, of course, risks associated with using Botox due to its mechanism of action. Since the toxin produces paralysis, patients risk relaxation of unintended muscles. Overall, the structure of botulinum neurotoxin type A1 allows optimal interaction with SNAP25 with subsequent paralysis of the muscle, resulting in its medical and cosmetic effects.